This segment of DelmarvaLife is brought to you by TidalHealth.
In 2007, TidalHealth Peninsula Regional became the first facility on the Delmarva Peninsula to use a Da Vinci robot. Since then, they have performed more than 1,000 robotic surgical procedures across many surgical specialties.
Now, those procedures are also performed at TidalHealth Nanticoke in Seaford. And Shayna Selva is no stranger to those procedures. She's a physician's assistant with TidalHealth General Surgery at Nanticoke. Thank you so much for joining us.
Yes, thank you for
Good
having
to
me.
have you here. Okay,
Yes.
I want to talk about you before we talk about those procedures.
Okay.
What got you interested in healthcare?
So before I decided to go into PA school, I was actually a dental hygienist. So it was actually my patients and my coworkers. I was also an instructor for dental hygiene. They always would tell me, they're like, your bedside manners, your interaction with people, it just, what would you think about medicine? I actually was going to school to try to pursue dentistry, to be a dentist, but I actually decided to then, when everybody was telling me about medicine, I was like, let me just dive in and see what I can apply for. So I applied to PA school, and here we are.
Here we are.
So what do you work with now? What do you do?
I do general surgery.
Anything?
Yes, in any realm of general surgery, yes.
Wow.
Whatever walks into the door is what we do.
All right. So as we mentioned, TidalHealth is a pioneer when it comes to robotic surgery. In your experience, how do you see that transforming healthcare?
I think, honestly, medicine's always advancing. It's always, trying to find an innovative way to just improve patient care, patient outcomes. And we see it now, post-op recovery time is a lot less. You're also not walking around with a huge incision. It's more aesthetically pleasing to have tiny incision versus something down the middle. So I definitely see, we see good outcomes now from, robotic surgery. And most patients lean towards that versus having to be, cut open.
Yeah.
So
TidalHealth uses a team approach.
yes.
How is that beneficial to everybody involved?
So, there's no I in team, like I always like to say. So it's always a dynamic approach. Obviously, I'm a mid-level provider. It's our surgeons. We're working with hospitalists, our nurses, OT, physical therapy, our LPN. So it's always everybody working together to obviously provide the best care for our patients. So I really do believe that, we all have to work together to make sure that everything goes well.
Yeah. You seem very passionate about what you do.
I do. I love what I do.
What's the best part of it?
Just patient interaction, to be honest. I definitely enjoy just talking to people and just, no one feels great when you're at the hospital, but I always feel like I do make them feel a little bit better when they interact with me.
So how does TidalHealth make the communication happen between the provider and the patient?
How do we make it happen?
Is this a MyChart thing? Is that what MyChart does?
So MyChart helps a lot. It's a nice portal for patients to be able to see results, to communicate with the providers, to also, see their appointments. It has its pros and cons, obviously, like anything else, but for the most part, it is nice to have MyChart because we feel closer with our patients. I know patients will message me when they, have questions, and I'm always there. Everybody's on their phones.
Yeah.
So, I'm able to answer them pretty quick, and they feel happy to just be able to reach their providers, because it can take a long time, especially with specialties to get in. It can take weeks to months. So it's nice to just have it right there in your hand.
Yeah.
Yep.
Yeah, absolutely. Shayna Selva, thank you
Yes.
so much with TidalHealth General Surgery. Thank you so much for coming in.
Thank you.